Hi, I'm Dr. Kim Lara. I'm here with my husband, Dr. Jose Lara, and we're here today to talk to you about problems of the neck, the shoulder, the arm, that radiating, maybe electric like shock pain or even numbness in the hand that many of us can experience.
Right. So once you have some kind of symptom like that, it is recommended that you have an evaluation for it. It could be a
Mhm.
physical exam and perhaps x-rays, and if necessary, an MRI. So you have to determine what is causing you to feel pain, tingling, burning, sharp, stabbing, dull, achiness into either your whole arm or just portion of the arm.
And what we have seen happen as the cause of this problem many times is just simply the spinal vertebral subluxation. And that's where a vertebra, this is a vertebra from the side, actually moves back and literally pinches and chokes that nerve. And the correction to that is very simple. One of the options would be a simple adjustment where we take that bone and very precisely place it back in the position, alleviating that. But if that is left unchecked and not treated, more serious problems can happen.
Correct. So once you determine that just an adjustment, which is the correction of that misalignment that's created inflammation and pressure to the nerve, is not as effective as it should be, it is because most likely the disc is involved and an MRI has been taken. Maybe you had gone to your orthopedic or your primary doctor and they ordered an MRI and you were diagnosed with a herniation or a bulging disc and they're giving you the options to, we're going to send you to perhaps some therapy and then lastly, a surgical case.
Right. The physical therapy and things like that are usually really great. However, there's a proper time for that. So if you start exercising the neck and doing these stretches and resistance exercises on top of a herniated disc, which basically is that bulging of the material on the nerve, you're going to make it worse. So as Dr. Laura was mentioning here, the other option would be surgery, and you can mention to them it's not as easy of a surgery as many people think.
Correct. So once the diagnosis has been made that there's a bulge, that this is this material, looking at the spine from the side, of course, we have the vertebra, the disc, and nerve tissue coming out from the side. The vertebra is compressing down the shock absorber, the disc, into going into the canal and compressing the nerve. So once that's there, there's really only two ways to remove it or correct it. And one is a surgical approach. In surgery for the cervical spine, it's a lot more delicate than, let's say, the lower back. Because if you look at this MRI here, this is somebody looking from the side. This is the musculature, and this is the spinal cord area. So you don't go through the back of the neck and address the disc. You have to go through the front. And when you go through the front, you got the carotid arteries, you have other vessels here that are very delicate that sometimes become a problem in a surgical case. So the risk is very high just for the fact of going through the front of the neck. And then you address the disc from the front, you remove it, clean it out, and usually put a cage on it. And you could have issues with that cage system.
Yeah, sometimes the surgery doesn't work. Sometimes they touch or nick a nerve in the neighboring area. You got your thyroid there, your throat. There's a lot of risk. So if this can be avoided, we want to do everything possible in our power to avoid that surgery. And that's where the spinal decompression treatment comes in, the DRX 9000.
So the DRX 9000 works the same way once the disc is protruding like this. So when we look at the MRI of this individual here, this being the vertebrae or the bone, and this in between the bones being the disc when it's normal should not be protruding out whatsoever. As you can see with the green arrows pointing to here, we have a coming out of place, a herniation and a herniation there. So the spinal decompression works by reabsorbing, causing a negative pressure within the disc to create a vacuum to reabsorb the material back in, decompressing the disc instead of going in manually or surgically. So when you look at an MRI from the top down this way, in this position, this being the disc and this being the spinal cord where the nerve tissue is involved, you can see the herniation clearly there. So it is a pretty bad herniation, compressing nerve tissue, creating tingling, burning, sharp, stabbing, dull, a weird sensation in the arm to the point that it's so painful that you just want to sometimes cut off your arm per se.
It's
So the
painful.
pain is real. So surgery, it is an option, and it is an option that if you take all the risk away, could effectively work. But the risk is too high,
Yeah.
and there is another option for that spinal decompression with the DRX 9000.
Yeah. And when we do these treatments, it can be anywhere from 12 to 20 treatments. And the patient, typically, those symptoms will gradually, over time, start to feel better. And then we go a step further. We make sure the cervical curve is being restored, the alignment is being restored. And then it's the proper time, which we do here, rehab the muscles, might be electrical muscle stimulation, laser therapy, rehab exercises, because we want your neck to be in the absolute best condition your body will allow and to keep it stable as long as possible. So if you have any questions about this, or if you've been thinking about this treatment, or know anybody, there's people who are desperate with this pain, they can't sleep at night. Let us know. Have them reach out to us. We have consultations at no charge. Dr. Lara can review the MRIs. There's a lot we can do for patients like this.
So take action. Sometimes there's an answer right around the corner. So we hope to help you, and we hope that this has been beneficial to you.